or monogamous. And I have to call the shots as I see them, and that's where I will continue to work from.
Do you think the figures of the number of people who will eventually be afflicted with this disease or die are overestimated or underestimated?
I think they're as accurate as we can make them, and remember, we had never predicted beyond 1991, and we didn't do that until we had 5 years' experience behind us. We've been very careful. If anything, I think they are underestimated. But if you look at the world instead of the United States, you have more problems with statistics because the third world countries have difficulty, A, in producing the tests that are required to make diagnoses, but they also don't have the statistical support that we have in the Western world. Even so, having just returned from the World Health Assembly at Geneva, I can tell you that the figures projected for the planet by the early years of the next century are absolutely frightening, and that would be between 50 million and 100 million deaths. And in some of the Central African republics, the seropositivity of the cohorts that have been studied is as high as 17%, and that's extraordinarily frightening.
Dr. Koop,
yes.
Rick Yenser from the Muncie Star. Given this crisis, just what's the federal government going to do then?
Well, the federal government is doing what it should do. We have a disease that has 100% fatality, for which we need a vaccine, which is not yet on the horizon, and for which there should be some efforts toward a pharmaceutical cure. However, the only weapon we have right now is education. The budget that the President has called for the next year, I think, is adequate to do the things we have to do. 25% of it will go toward education, and we will launch AIDS Awareness Month on the 1st of October and really have a barrage of all kinds of educational material through every known medium in order to acquaint the people of this country with how they can protect themselves against this disease. It isn't so much money we need as innovative ideas and the passage of time. You just can't make a vaccine overnight. It took 19 years from the discovery of the virus for hepatitis B until we had a generally available effective vaccine. Now, we can move a little faster now because our techniques are better. But this is a very complex virus compared to hepatitis B, and although I would love to see something come down the road in about 5 years, I'm not sure it's realistic to think it's going to happen that soon. Yes, sir.
Dr. Koop, Paul Schleiner, Public Radio. We're seeing now local governments passing mandatory AIDS testing. What are the problems associated with that?
Well, the major problem with mandatory testing is that the people that you're trying to find can slip right through that net. It costs a tremendous amount of money to do mandatory testing, and you're testing all kinds of people that do not practice high-risk behavior and who are not going to turn up positive. The other thing about mandatory testing is that with this disease, there is a tremendous stigma that has not existed for other diseases in our history. And you could be a man, for example, who had a blood transfusion in 1984 before the blood supply was safe, and have been able to keep that secret from the public that you are now seropositive to the antibodies for AIDS. If that were known today, you could lose your job. With that, the insurance that would take care of your desperate final illness. You could lose your housing. Your kids couldn't go to the school they want to go to. You'd lose your friends. And as has happened over and over in this country, whole families have had to pack up and leave the community where this was discovered. Until we get rid of the stigma, public health officials in general believe that the rights of the individual to privacy supersede the need for the public to know about the status of anyone's blood test. Now, if we could get rid of that stigma, we might change our minds about lots of things. And remember that just knowing who is positive and who is negative is not going to contain the epidemic. People have to change their behaviors.
What's the solution to screen those who are at high risk?
Well, we know that the people who are at high risk are flocking to voluntary testing sites where they are assured that they are only a number and therefore will be anonymous. Confidentiality was almost meant to be breached, as you know, but anonymity is something that you can handle with this problem. There are now lines waiting in New York for 8 weeks to get a blood test anonymously for the AIDS virus, and in San Francisco it's about 4 weeks. So we know that lots of people are anxious to be tested, but they don't want you to know the results.
You'll be meeting with some hospital staff this morning, Doctor. In light of the CDC's finding that 3 hospital staffers were infected with the AIDS virus, will you be telling this staff anything about the problem?
I'll be answering questions. If they ask them, I'll answer them. But let me just say a few words about those. Those are very unusual cases. 3 different people working with blood that was contaminated, but none of them following the guidelines that we published 2 years ago for health workers on how to avoid the contamination with the AIDS virus. Had any of those people been following the advice that we gave 2 years ago, there could have been no transmission of the virus.
Are we talking about someday then mandatory AIDS testing for everybody?
I don't think so. At 240 million people, $14 a test, extraordinarily expensive. The people you want to get, as I said a moment ago, could easily slip through that chain. And you've got to ask yourself, what are you going to do with the results? There are 2 kinds of people out there who want this done. People in public health who are concerned about making projections, but then there is a tremendous group of people in this country who are so opposed to the 2 groups of people in whom this disease was first found, homosexuals and IV drug abusers, that they'd like to bash these people, and that is not going to correct this epidemic. I'm concerned not just about that, but anytime that you begin to push one group of people, you begin to establish a system where the civil rights that we fought so hard for are going to be abrogated. It is known right now that there is a disproportionate number of Hispanic and black people who have AIDS. There is also a disproportionate number of individuals in those 2 ethnic groups who are IV drug abusers. We've got to avoid putting these people in a position where they are going to be victimized by people who don't understand the disease, but instead use innovative and creative ways of reaching them so they can contain the epidemic.
What can be done to ease fears of people who don't have the disease or whatever, and they are not really aware or either not accepting?
Education, education, and more education. That's all we can do at the moment.
The President has put a lot of emphasis on abstinence as the way of controlling AIDS. Has he done that to the extent that he's not talked enough about education and safe sex?
The President will be making a major statement next Sunday on AIDS at the dinner that is being put on in Washington by the Medical Research Foundation for AIDS. The President, is involved in many things: teenage pregnancies, drug abuse, AIDS. For all of those, the best answer is to say no, of course, or to say later. But the President is very well aware of all of these problems, and I think that he knows that people he's appointed, such as your former governor to be head of the Department of Health and Human Services, are handling this problem to the best of the ability in the state of our knowledge today.
With so much money devoted to AIDS research, are we neglecting anything else? And if so, how do you feel about that?
Well, I suppose you'd never, in an ideal world, have enough money for research. But you have to look at priorities. I don't think that the rest of the research world has suffered because we're putting money into AIDS, and I think the amount of money planned for next year is adequate at this stage of the game for this particular problem.
What is the money for AIDS research?
Pardon?
What is the money for AIDS research?
Oh, something like $580 million.
Could I shift very quickly to one other topic? Do you support the research that has indicated that people can be harmed by the cigarette smoke of others?
Do I support it? I certainly do. The report that I submitted to Congress and the people of this country on the 16th of December this year was the first report by a Surgeon General on the effects of passive or side stream smoking on the non-smoker. And the evidence is clear. It is not just my evidence, it's the evidence of thousands upon thousands of workers who have put out a number of studies on this subject, and the Environmental Protection Agency and the National Academy of Sciences have both submitted to the public separate reports on the deleterious effects of side stream smoking on the health of the non-smoker.
Have you had any input on next week's AIDS speech? And does the president take a stand on safe sex in that speech?
I don't know about, I never use the word safe sex or safer sex because it means different things to different people. I think they're both bad terms. I think we ought to say what exactly we mean. Abstinence, people understand. Monogamy, people understand. Condoms, people understand. I don't know what the president will say, but I know he's aware of all these things, and the way government works, you know, is not for the president to make public pronouncements, but he works through the cabinet system, and that's the way it goes.
He just projected 50 million to 100 million deaths, I guess, by the next century. What is this world going to be like then? What is this all going to come to, not only with losing so many people, but I mean socially? What will this earth
It's
look
an
like?
excellent question, sir. It isn't what the earth is going to look like, because I think most countries, say in our situation, can, by changes in behavior, overcome the future. The concern of many of us is what's going to happen to some of the Central African countries, where we know the high percentage of seropositivity and the fact that these people are now in the pipeline of getting full-blown AIDS or one of the opportunistic infections that goes with it. And people who have studied these things and have much more skills than I have predicted that for some of these countries, before the end of the century, they may have run out of the elite manpower that they need to run their governments and to take care of the things that make life go.
Will the federal government have to assume most of the burden of the medical cost related to this?
That has never been settled. I have been calling now for 4 months for consultations at the highest levels between federal, state, and municipal health officials on to how we're going to pay for the cost of AIDS, how the money will be raised, what it will be used to pay for, and the second part of that is where will insurance fit into this picture. And I think these are matters of urgent need in discussion, as is a corollary to that, and that is the manner in which we will take care of the burgeoning numbers of people in their terminal illnesses.
And I wanted to back up just a little bit. You were saying that in some countries they may even lose the elite manpower.
Mm-hmm.
What about in the United States? What do you think? I mean, if the trend continues as it has, what will the effect be in the United States? Do you honestly think that we will, you think we will lick this thing?
I think, oh yeah, we will lick it. There's no doubt about it. We won't lick it soon enough to suit you or me. But I would like to make one thing very clear. Right at this moment, we are standing on the threshold of the future. And we don't know what that future holds in reference to heterosexual spread of AIDS. We know what happened in the homosexual community, and we can predict the future. We know what happened in the drug-abusing community where they share dirty needles, and we can predict that future. What we don't know is whether we are standing on the edge of an explosion in the heterosexual community, the way we had it in the homosexual community in 1981 and 82, or whether people will indeed, as the homosexuals have, listen to the educational program and change their lifestyles. This is a disease that can be contained if people will listen to what we're saying and act on it. You run out of questions. That's good. Thank you.
Thank you.